My name is Tracy Brown. I'm an occupational health and safety specialist with the CCOHS, or Canadian Centre for Occupational Health and Safety. And I'm the host today of a conversation we're having with two special guests from McMaster University. I'd like to welcome Roger Couldrey, Vice President of Administration, Health and Safety Specialist, and Team Lead for the Environmental and Occupational Health Support Services at the university. Roger and Dane, welcome. Thank you so much for joining us today during Safety and Health Week 2021. Today, we are going to talk about health and safety leadership, and we are going to ask our guests about some of the health and safety changes that they had to implement at McMaster as a result of the COVID-19 pandemic. We're going to talk to them about some of the challenges that they faced, what they learned from it, and how we can continue to make health a priority not only during the pandemic, but once the pandemic is over. We would like to hear from everyone who's listening in. If you have any questions at any point during the session, please don't hesitate to ask us those questions. You can enter your questions through the chat or through the question and answer window. And what we're going to do is we're going to save some time at the end of the session to address the questions. And depending on the number of questions that we have, if we don't have an opportunity to get to your questions, no worries. We'll make sure to email out responses following the session. So please feel free to ask any questions through the chat or through the question and answer window. So to start, I'm just going to ask our guests to introduce themselves and tell us a little bit more about their leadership role at McMaster.
Good afternoon. Thanks, Tracy, for having us today. And thanks to all of our participants for joining this conversation. My name is Dane DeMan. I am a Canadian registered safety professional. I've been working as part of the health and safety team at McMaster for 11 years now. Time flies when you're having fun. I do lead a team of health and safety professionals at the university. We work collaboratively with our Faculty of Health Sciences, who have a dedicated team of safety professionals as well. And collectively, our groups, we manage all of the safety programs right across the university.
Hey, thanks, Dane.
Thanks, Dane. That was great. I'm Roger Couldrey. I'm the VP Administration at McMaster University. Health and safety is one of a number of areas that reports into me. And it reports in through Lisa Moraine, who some of you may know, who is unable to be with us today. So hopefully you're listening in, Lisa. Health and safety is an important function at MAC. We have a structure that I think Dane will take you through in just a moment. Then a structure that has me sitting on the Central Joint Health and Safety Committee as a regular member. So I'm actually quite engaged in the health and safety discussions across campus, which is, I think, the right leadership role to be taking.
Okay, thank you very much. So at the Canadian Centre for Occupational Health and Safety, we provide information on a wide variety of health and safety hazards and topics, whether that's chemical hazards, machine hazards, COVID-19, ergonomics, workplace violence and health, or stress. There's a large number of topics that we provide information for. So when I think of a large university like McMaster, where there's different functions and different buildings, I'd imagine that there's a lot of different types of potential hazards that you might be faced with. And then another consideration, of course, is that you're spread out geographically. There's a large campus, of course, in Hamilton with multiple buildings, as well as smaller satellite campuses in nearby cities such as Burlington, St. Catharines, and Waterloo. So I just had a question around that, like, how do you manage health and safety hazards at a multi-site workplace such as McMaster, and what good practices can you share? So Dane, let's start with you with that question.
Yeah, and because of the type of organization that we are, being a post-secondary educational, we really do see a broad spectrum and manage a broad spectrum of hazards in the workplace. We've got labs with chemical and biological hazards. We've got hospitality and food service workers. We've got trades groups, custodial groups, office staff, athletic facilities, libraries. It's really a unique workplace as far as health and safety goes. And as you've alluded to, we're spread out. So we do have a main campus here in Hamilton, Ontario. And in addition to that, we have many off-site locations, both within Hamilton and sort of spread out in the Southern Ontario region. And one component of our health and safety system that I think is the foundation of our internal responsibility system is our unique Joint Health and Safety Committee structure. We are set up in such a way so that we have 25 plus joint health and safety committees. And those are based on specific faculties, specific departments, and as well, of course, our offsite locations. Each of these committees, they essentially report up to one, what we call a central Joint Health and Safety Committee, which Roger has alluded to in his introduction. All of the local committees have very great representation from our workers, from our management members, and that central committee as well. We've got worker and management members from all of our local committees that are represented on that central committee, in addition to some of our more senior leaders at the university, including Roger. And I'll point out, Roger being quite senior as our member of that group and a regular attendee, he's an active and engaged participant. And to me, as a health and safety professional, that's powerful, and it's very encouraging to work in an organization as I do with that type of leadership. The Central Committee, they review all of the minutes from our local committees, so the monthly committee minutes, monthly incident summaries. And that Central Committee is also a nice opportunity for our local committees to raise any issues, concerns that they're challenged with up through to that Central Committee for additional attention if needed and assistance with resolution. So it works really well. I'll also note that my team, as well as our partners in the Faculty of Health Sciences, we play a direct advisory role to all of those local committees. And really through those relationships with not only our committee members in specific areas have worked out through faculties. Any one of us can walk into a particular area that we play an advisory role to, and people know who we are. They know our name, they say hello, they ask us questions, they reach out to us for support. So that's pretty powerful in itself and impactful. I'll highlight actually one of our off-site locations in downtown Hamilton. We have a campus right at 1 James North. And it's not uncommon, and this is a group that I specifically represent. It's not uncommon for me to regularly be contacted by our worker members, our management members within that group, all the way up to the CFO of our organization, who happens to be a management member on that group, and again, very passionate and committed to health and safety. So it's a mechanism that we're proud of. It works well, again, and it really helps to foster our safety culture and our to respond to issues quite quickly. And several years ago, we had a fairly significant incident involving a few of our staff members at our downtown location. And it left some lingering concerns for the broader group of staff that we have on site. And we were very quickly able to mobilize a building-wide town hall that included myself, some of our senior leaders on site, and other leaders within the McMaster organization to sit down with our staff on site and talk about corrective measures and preventative measures that we were planning to put into place going forward, and to listen to their feedback, answer their questions. And that worker engagement it's so critical, listening to your workers and continuously improving based on.
So Tracy, just adding to that for the audience here, a couple of quick thoughts for you. One, that incident that Dane is referring to, that the CFO was on my phone texting me within about 5 minutes of that happening. It gives you a sense of the sense of responsibility that the senior leaders feel. And you asked about best practice. I mean, this sense of responsibility is certainly one of the best practices that has paid back well for McMaster. Another that Dane mentions, the structure. You know, we're highly decentralized, and in our decentralized environments, we have some very sophisticated health and safety issues. That structure reinforces a reporting requirement and a responsibility requirement that is, I think, felt very seriously by those that operate on a remote basis. So they may be away from home base, but that doesn't diminish their sense of responsibility and accountability. And I think that's another best practice, Tracy.
Okay, thank you. And I imagine just that structure, as you mentioned, about information sharing and having, 25 committees and then a central committee. Do you find that helps with the information sharing? So if there was maybe an incident at a smaller location, that maybe the learnings or the root cause or whatever the hazard is could be addressed at other locations as well?
Well, that's exactly what happens at Central Health and Safety. As we review all the incidents and all the minutes, people will make exactly that observation. If that happened in location A, what's preventing it happening in location B, and what's our policy as an organization? So that's exactly how it plays out, Tracy.
Okay, great. Okay, thank you. So when we think about the pandemic, it of course has changed the way that we work across Canada. And at the CCUHS, at the beginning of the pandemic, we heard from businesses and workers looking for COVID-19 information. So, we started to prepare COVID-19 tools and resources that were, specific to different sectors and different occupations. So we prepared tip sheets, infographics, videos, training courses, etc. So that work's ongoing, and we have to update it accordingly as the information changes and we learn more about the science of the virus. So really thinking about these changes, Roger, what sort of changes did McMaster implement as a result of the pandemic?
This could be, wasn't this the test of all health and safety systems? I mean, I could go on for a long while talking about this. So just a few high-level points for you, Tracy, and I'm sure Dane will help with the response. First of all, we have a crisis of health and safety structure. Many of you members would have those. We have a crisis management group that I chair. It's staffed. It was in action at the moment that we learned. In fact, it was in action back in January in the Canadian context. And we had begun to plan for how we might respond to this. Having said that, I don't think I'd be bold and say that we'd anticipated all of the issues. We hadn't. Our group met daily, sometimes more than once a day, with a senior leadership group that eventually expanded to be the entire leadership of the university. 43 of us met every Monday morning and every Thursday or Wednesday morning on a consistent basis in order to manage the issues that kept arising. And again, I think another really good practice. It's a university. It's a small town. We have 35,000 people on campus. And they're all walks of life. There's obviously 30,000 plus students, but there's a lot of professors, there's obviously staff, there's suppliers. There's a wide range of people on campus. Very, very difficult for us to communicate broadly to the platform in any crisis management or health and safety matter. Some of the things we did, I mean, we had to close campus. We had to make provisions for students that were living in residence that could no longer get home. They were in Hamilton from China or from India or from Brazil, and they could not get home. So we had to make provisions to accommodate those students. We had to make provisions for students who arrived at the university because they could arrive at the quarantine. We had to set up quarantine residences on campus, testing schemes on campus. So we did those. We moved to a working from home situation very, very quickly. And that the remote communication tools, Zoom has become our best friend. But I found myself using all sorts of technologies that I never dreamed I would ever use. And now they're second nature. So we had to put in place the licensing and the technology platforms to be able to do that at relatively short notice. We had to put in place provisions for remote work, particularly the issue of pay. We made a determination very, very early on that no matter where people were working or whether they could in fact work, for the first period of time that we were going to pay them anyway. We wanted to give them certainty and reduce anxiety very early in the process. And I think that was a fairly key decision that we made very, very early on. We're fortunate, we have a lot of expertise at Mac. The virus was isolated by one of our professors working in conjunction with a professor in Sunnybrook, I think. And during the course of the pandemic, many of you wouldn't know, but we've had very active research going on at the university with respect to the virus and how the virus should be treated. Even the clotting disorder that you heard about recently with AstraZeneca, our researchers have been working on that for some time. So lots of active research into the virus, and yet our campus is closed. So how do we make provision for services and safety, security on campus? Because the researchers have to be there to be able to carry out the research that they're doing. How do we do that? So lots of innovation, lots of creativity, lots of borrowing from other people's good ideas, but a lot of flexibility and a lot of communication. I'll stop there. Dane's got, I know more that he could add to this, but this was and actually continues to be quite an undertaking.
Yeah, and Roger's very nicely highlighted a number of the changes we were essentially forced into quite quickly, whether it be our student population and finishing the semester virtually last March and continuing that into the fall and throughout this academic year, scaling back some of our research operations, although as Roger has suggested, we have some incredible research specific to the COVID-19 virus and to vaccinations going on right here at McMaster. And of course, we shifted many of our workers to a remote work type environment. So staff members who couldn't work remotely. We've got staff groups who have been working on campus for the last 15 months. And so it was very important as part of our responsibility to take every reasonable precaution to quickly develop programs and procedures and guidance documents, training for all of our staff groups that are and have been working on campus. You know, anything from screening prior to accessing campus to physical distancing requirements to masks and face coverings and other personal protective equipment. So we really quickly were able to pull a lot of that support and those tools together to make sure that we were supporting our workers and really our entire campus community. Again, Roger, mentioned McMaster is a small city. We're a community, right? We've got workers, students, visitors, volunteers, and so it was quite important to make sure that we had a sounds for anyone accessing our campus. With some of these changes came challenges. We have areas on campus, I think of our athletic facilities, our libraries, our hospitality and food service areas, our residents. These areas are normally thriving with people. And for the most part, over the last 15 months, a lot of these areas have had very minimal, if not zero, activity in them. And that's certainly been challenging as well. And with opportunity, we were able to utilize some of our vacant resident space to house some of our incoming international students. Many of these students are arriving internationally to participate in very important medical programs that we offer here at McMaster. And we were also somewhat more recently able to open some space up to support the Hamilton community and Hamilton healthcare workers. So workers who are right on the front lines of this virus, the opportunity to perhaps isolate away from loved ones, family members, while they're continuing on the front line. So a number of our staff groups were involved in those procedures. So you think of food service, cleaning, custodial work, our trades group, our security staff. So again, we really had to put very specific standard operating procedures in place to make sure that we were protecting those folks as well. So.
No, thank you for that. It really sounds like a lot of dramatic changes have taken place at the university in order to protect not only workers, but other people like students, as you mentioned. So when you think of some of the health and safety changes, I'm sure some of them will go away with COVID, but others, do you think some of the, your crisis management team, updates to procedures, do you think any of those types of changes will be sustained after the pandemic?
So, as you may anticipate, Tracy, we did, as part of our risk management program, we did a review of how well we had responded to the pandemic. And in fact, the summary report went to our audit and risk committee this morning. So we reviewed what we did well and what we didn't do quite so well. And of course, there's items in both columns. I feel fairly certain that the remote working arrangements that were put in place in a great rush have actually addressed a long-standing need for more balance in work life that I think will stay full stop. I think the technology, we moved overnight to a more online platform, both from a teaching and learning perspective, but also from an administrative perspective. And I feel quite sure that a lot of that will stay as well. Some of the policy provisions we put in place around flexibility, I'm sure those will stay. And cost recoveries, the provision of home offices, for example, how do those get paid for? I think it's been a positive turn of events by very, very unfortunate circumstances.
And I'll just comment that with some of these sustained changes, thinking specifically of a remote work type scenario or some sort of a hybrid type scenario that many of us might find ourselves in going forward, there are certainly risks that we need to be mindful of and consider as well outside of COVID, right? And I think specifically to ergonomics in a remote work type situation. I've heard comments over the past year that many of us were making do with our remote work setups, whether it's at the kitchen table or dining room table, or whether we had that. So I think we need to continue to focus on some of those external factors. I think of, are we going to expect less people in the workplace with more people working remotely? And are there working alone considerations? So emergency preparedness, violence, harassment, those types of things. So I think some of these sustained changes will be wonderful, and a lot of people will appreciate sort of the new world of the workplace. I just think we need to keep our eyes on some of the additional risks and challenges that, from a health and safety point of view, will arise out of that.
Thank you very much for that. And I also think of when you were talking about working from home, the importance of getting worker input on, what they might need from equipment or whatever it is, ergonomic support. So I'm thinking a little bit about worker participation, and across Canada we know that's an important right, that workers have the right to participate in health and safety, and that can be done in so many different ways. You've already touched on, for example, health and safety committees, or by raising hazards to your supervisor or employer, asking questions. So just thinking a little bit about a worker input, can you provide any comments about the importance of getting worker input into some of the changes that you've made at the university as a result of COVID? And during the pandemic, how have you, what approaches have you used to reach out to workers and get their input? So maybe Dane will start with.
Certainly. And not only is worker input a right, or the right to participate, it's also a critical component of any effective health and safety management system. Your workers are your key stakeholders in all of the work that we as health and safety professionals are doing. So I can't understate the importance of worker input. And at McMaster, we really do place value on worker input, and we solicit that input in a number of different ways, both formally and informally. Whenever we do health and safety programs, we form representatives from different groups and areas on campus. We engage and collaborate regularly with our union partners. We have many different union groups at McMaster. I'd be remiss if I didn't give a shout out to our employee and labor relations team at McMaster, and the incredible work that they do with our union partners and the relationships that we have with those groups. I think throughout the last 15 or so months, the number of times we've met with union representatives to talk about program changes, changes to screening, or decisions on personal protective equipment and face coverings and masking, and really soliciting their feedback and their input. So important. We also receive regular feedback from our campus community on our various training programs, our health and safety programs, and we're often able to make very positive changes to some of those programs based on that feedback that we do receive. I did touch on the Joint Health and Safety Committee structure a little bit earlier, but that's also an important mechanism for obtaining worker feedback. I'll highlight actually a specific example with our campus services Joint Health and Safety Committee that I'm an advisor to. So this committee is made up of predominantly staff who have been working on site. So this would consist of our trades group, our custodial group, our grounds team, our security folks. Early on in the pandemic's protocol, so a reporting protocol for individuals who are working on site, to report if they've tested positive for the virus, and we developed a tool in doing so. And as individuals report through that, there's a number of actions that are initiated quite quickly through a rapid COVID-19 response group, to include any necessary cleaning, communication, and we also provide direct one-on-one support to our staff and our students who report in through that tool. And here I'll make mention of our fantastic occupational health nurses. We've got two of them, Rachel and Jillian. They provide one-on-one direct support to each and every individual that reports through that tool. And the same thing happens on the student side through our Student Wellness Center. And it's just amazing the sometimes round-the-clock work that they do on that end of things. The reporting tool also initiates a communication to our broader campus community. And very early on, that communication, the details of that communication were kept fairly minimal, in trying to balance the worker's right to know and protection of individual privacy. And so we really, early on, we communicated when there was a positive case, that we've received information on a positive case on this date, and that public health would be conducting any further contact tracing. And what we heard through our campus services through a discussion at that committee was that workers really wanted to know the specific building location of that positive case. And while continuing to stress that as long as individuals are following all of the procedures that we have in place for working on site, they are at no additional level of risk. We heard that concern, that comment, that want to know the building location, and myself, I was able to take that to my leadership team, our co-chairs, our worker co-chair, Nick Van Egmond, our management leadership team, and we were able to affect a change in that communication process. And now all of our communications on positive cases on campus, they do include that specific location here at the university.
Okay.
Worker feedback it's all about continuous improvement, right? We think about implementation of any new program. I think of the plan, do, check, act model. We've done a lot of planning, a lot of implementation over the last 15 months, and now we're in this continuous cycle of check, act, check, act, check, act. And it's, worker feedback is a very valuable part of those checks and those acts as part of the continuous improvement at McMaster.
Okay, Roger, did you have anything to add to that?
Two quick things, Tracy, if I could. First of all, an observation that Dane has just referenced, which is how important it is, how obviously important it is that there are constructive relationships between the management of an organization and the worker representatives, the trade unions, the employee groups. That is so critical. I can, as I was preparing for this, I was thinking of how many times have people brought forward things that they feel we need, that we've been able to hear and respond to. Most recently, it was defibrillators on campus at the last Joint Health and Safety Committee meeting. We found we had an exposure in that space. So, but the other thing that I wanted to reference was we're getting ready to return to campus. We call it Return to McMaster, and hopefully we'll be able to do that in the fall, vaccinations and public health allowing. So in order to prepare for that, we sent out a survey to our campus. And just on the staff side, we had over 2,000 responses to this survey. And they were sorts of variations. And it took two people multiple days to go through and prepare a report. But how valuable. We had people coming back to us to say things like, well, if we're going to be back to campus in the fall and students are going to be on campus, how are we going to know that students are vaccinated? Simple question, but it's really complicated. So we're working our way through. In fact, later on this afternoon, I've got the next meeting with the Return to McMaster group, and we're working through not all 2,000 responses, but the themes from those 2,000 responses. So in answer to your question, how do you get feedback?
Yeah, that's great. And it shows that you're listening to if you're making changes as a result of some of that feedback is quite powerful.
Yeah.
So my next question is just around some of the challenges that everyone's faced as a result of COVID. And one challenge we certainly noticed at CCOHS was just the pace of information changing. And we really learned we had to be nimble and adapt to that and make changes as required. So we, for example, had to make a change to how we updated our resources and documents so that they were current and relevant at all times. So I'm just thinking about health and safety challenges. What is maybe one of the biggest challenges that you faced during the pandemic? How did you overcome that challenge? And what did you learn from it? And Roger, let's start with you on that one.
I gave you a few examples of this earlier on in the discussion. One, and you've referenced this to some extent, one major issue was there's no playbook. This was the script for this play changed by the day, and we needed to innovate on an ongoing basis. So having in place a structure that allows innovation is, I think, really was really critical. Another good example here were community requests. We had a number of requests from the community as we went through this. What I'm saying is, it's past. As we're going through this crisis, we had a number of requests from community groups to use our residences for quarantining purposes. And initially, Tracy, we thought, wow, this is a high risk consideration, probably for everybody. But how do we go about doing this? Because it's a community need, and how could we possibly come up with a methodology to handle this? And we probably had a handful or so of these requests, and we managed to find ways to put together a response that seemed to work. Now, a few of them, as it turned out, needed to be taken up, and that's good news. So the organizations in question had a backup. But it's a good response to your question. We had no plan to provide residence buildings to community associations, but we found ourselves able to respond to the demands, given a few days to think through how we might go about tackling it. I think some of the lessons you learn from this, and I think the world has learned the criticality of frontline workers as you work through this. We could not have done what we've done over the last 15, 18 months if it weren't for the nurses, the occupational health nurses, the nurses in student wellness, the custodial staff at the university who have been cleaning on demand as issues arise, the security group, the trades group. There's been innumerable, the hospitality group providing meals on demand. I mean, there's been innumerable examples of how we've relied on people. And I think we need to, you see lots of signs on the streets of thank you to frontline workers. And I think that's very, very well deserved. And I think I'd like to just take this moment just to add my thanks to that, because huge thank you to the frontline workers. But I do think one of the things that was important as we went through this, Tracy, so one of the things we learned, stability and control. We're a large organization. We could easily have come across as out of control. With the decentralized operation that we have, we could have easily have been seen to be uncoordinated and unmanaged. And I think we managed to do the reverse. I think we came out as actually being very well coordinated and well managed. And a big part of that was the communication. We did a really good job on the communication side. So that's been, I think, another big lesson. Of course, we're a university. We moved 30,000 people from physical teaching to online teaching. And that was such a mammoth undertaking. And it's going to have benefits, and it's going to have had implications. Large numbers of people who don't have their university experience that they expected for the first year or two. So there are some significant implications to what we had to do, and so there are some unfortunate consequences. But we did the best we could to manage a very difficult set of circumstances very quickly. Hopefully successfully.
Thank you, Roger. Dane, did you have anything to add?
Roger answered that so nicely. Just quickly, one of the biggest challenges from my perspective was that constant change in information, and then act very quickly. We were learning things about self. We were learning about public health recommendations that seem to be shifting and changing, and of course our government changes and the regulatory framework around all of this. And for those of us living and working in Ontario, we're all familiar with the Friday afternoon announcement of a significant change effective Monday, and next thing you know, we're scrambling to make sure that we're able to support and implement our infrastructure accordingly to affect that change. So just the ability to again, as you've suggested, Trace, to be nimble, to be ready to adapt by the day. It certainly was challenging, and as humans, we struggle with change. Large changes in organizations. Some organizations have hired change management professionals, right? And this pandemic has forced large organizational changes, sometimes overnight. So it's certainly been a challenge, but again, lots of opportunity that I hope we've been able to highlight with you today.
Okay, thank you very much. So the last question is just around leadership. So the COVID-19 pandemic has really highlighted the critical role of workplace health and safety, and it's made health and safety a top priority. How can we keep this momentum and commitment to protecting workers top of mind, not only during the pandemic, but after the pandemic as well? And Dane, let's start with you.
This is an exciting question for me. Before I go any further, I am going to pause. I think it's important that we recognize how difficult the past year has been for each and every one of us, whether we've been directly impacted by the virus itself or indirectly impacted by all of the other implications that have come with this virus. It's important to really recognize that. But as a health and safety professional, it really is an exciting time for us. And one thing I've been saying to people lately is that people are speaking our language. Non-health and safety professionals talking about concepts such as the hierarchy of hazard control. This is a concept we've always used the hierarchy of control to apply to workplace hazards well before this pandemic, well before we were faced with this pandemic. And some of the risks that we've traditionally applied the hierarchy of control to, they might be higher risk than COVID itself. So it's powerful that people are speaking our language. How many of us 5 years ago could have pulled a room full of non-health and safety professionals and asked the question, what does PPE mean? How many people would be able to answer personal protective equipment? Maybe half. So it speaks volumes. I was in a meeting recently listening to our director of housing talk about the Swiss cheese model. And I thought, wow, that's a concept I was studying in preparation for my Canadian Registered Safety Professional exam. So really, really powerful that people are speaking our language. How do we keep that momentum going? I think it's important to highlight the connections that we've developed over the past year and change. Health and safety as related to COVID-19 has really touched every single part of our organization. And we are connecting with people more regularly than ever. Sometimes people that we we rarely have ever connected with before. People know who we are. They know to come to us with questions, concerns. It's pretty incredible and pretty fantastic. And the technology that we've been able to leverage, it's pretty fascinating. I think that's how we take this momentum forward. And I'll end with, Roger and myself, we're sort of the talking faces today on behalf of McMaster. We've got, and I've got a team of incredible professionals that I work with, both within my own team and our Faculty of Health Sciences team, as far as health and safety goes. And we've got incredible people throughout our entire campus community that have done a lot of great work as far as health and safety goes over the past 15 months. And if there's one theme that I think we can take forward out of all of this, it's we're all leaders in safety. Every single one of us, right throughout the entire organization, we're all leaders in safety. And I think that's an excellent theme that we can take forward.
Thanks, Dane. And Roger, do you have anything to add?
Well, it's a really good question. This encourages thought on. I mean, I say 3 or 4 things quickly. What's important? Structure, I think, is really important. Keeping this on top of mind. Responsibility, there's a sense of responsibility that needs to be there. Communication is critical. One of the best learnings that I had on COVID was when we did the retrospective for the risk management program. And we did it across a relatively small group. The survey that we did most recently was across a large group. At least in the short term, as we return from COVID, organizational retrospectives on what happened and how did we manage it, I think will bring to the fore the strength of the health and safety structures. And it's an idea that some of you may wish to follow up. Hopefully it's of help to you. I've enjoyed being here today. Thanks very much. And I'm glad you included me. I really appreciate it. Good luck in, I think you've called it Safety and Health Week this year, haven't you?
Yes, that's right. Yeah, Safety and Health Week. Yeah. Thank you, Roger. Okay, so we're kind of at time. If it's okay, we'll just maybe do one quick question and then we'll wrap up in the next minute or two. So we have received a few questions. So thank you everyone for typing those in. We'll just do one quick question now and then we'll make sure to reply to the rest of the questions by email. But there's just a question around remote workers and how do you keep those remote workers safe? So I don't know if you can talk a little bit maybe about ergonomics and hazard identification, that sort of thing.
We have an ergonomics program at McMaster, and we are in the process of developing more robust remote work guidelines and procedures. As part of our ergonomics program, we have highly skilled safety professionals who perform ergonomic assessments. We've actually met virtually with many of our staff members to review and assess their workstations and to really make sure that we're helping to facilitate that support and ensure that people are set up for ergonomic success. So it's a really great question. I think there's more work to do, and I think it is top of mind for certainly for our group right now.
Okay, thank you very much. Yeah, with that, we're going to wrap up our conversation today with Roger Couldrey and Dane DeMan from McMaster University. Roger and Dane, thank you so much for your insights and the discussion today. I just thoroughly enjoyed it. We will make sure to get back to participants who asked questions by email. So we thank you for all your questions, and we thank everyone for joining us today. And if anyone's interested in more information on occupational health and safety, please visit www.ccohs.ca. And thanks again, everyone. Please stay safe and healthy. And bye for now.